What's up, everyone? Hope everybody is having an absolutely tremendous Monday. I certainly am. Welcome back to the Dentist Who Invest podcast for another exciting episode. We're on episode number 48 now, creeping up to 50. I'm going to have to think of something special to commemorate that milestone. We have a tremendous guest with us today. You may have met him on the group. He's very active on there. He's always got lots of questions and insight about investing, and he's out and about too because he's got quite a few dental courses on composites, aesthetics, and he is the owner and runner of Scottish Dental Club. So please welcome our esteemed colleague, Dr. Tariq Bashir. How are you, Tariq?
Yeah, good. Thanks, James. Thanks for having me on. Honored to be part of the podcast series.
Oh, mate, the pleasure is all mine. Welcome to the show, and thank you so much for giving up some of your day to come and appear. Tariq, I think a lot of people know you in the dental world, but just in case anybody out there listening doesn't know you, would you like to do a little bit of an intro about yourself, when you qualified, your Scottish Dental Club, etc., all of those things?
Yeah, sure. So my name's Tariq Bashir. I'm a general dentist based up in Glasgow at the Visage Clinic, which is part of Bupa's Platinum Clinics. I've been part of the clinic since 2008. I qualified in Glasgow 2005 and did my MFDS. Did some SHO posts. Initially, wanted to go down the kind of restorative specialist route, and then stumbled upon going into practice and have stayed in the practice since then. I've kind of done a lot of courses nationally, internationally as well, in restorative aesthetic dentistry. Um, did some work with the Koi Centre in Seattle over the last few years and became a graduate of the Koi Centre, which is focused on occlusion and treatment planning. And then just last year, um, achieved my master's in endodontics through the University of Chester and Simply Endo, and now run my own courses on composite, anterior composites, and also founded the Scottish Dental Study Club with my wife, Sima. And so we've been doing that for the last 3 years. And we always have kind of guest speakers up, speaking on endo, oral surgery, rubber dam, isolation. We've had international speakers as well and got lots of plans for the next year.
Congratulations, my friend. That is quite the CV. Hats off to you. And
Thank
Tariq, that was actually why I wanted to get you on today because I wanted to talk about how we as dentists can start our own course because I know that that is the aspiration for lots of us. A lot of dentists out there want to share their knowledge via the vehicle of a course, and for someone who's been there and done that, I think you'll have a lot of wisdom to share on that matter. We're still in side gigs month, just barely, because we've got 2 days left, and I thought that this would be a nice way just to put a hat on it, so that you can share your experiences and maybe even give us some actionable steps for dentists out there who want to create a course. Because there is no, I don't think there's a manual really. You just kind of go for it. It's just kind of hearsay, and you sort of wing it and figure it out along the way. Or am I missing something, Tariq? Is there some resource or some help that you got, or did you just kind of go for it? What was your journey like?
I mean, to be honest, I've never kind of planned to do this, and I initially kind of started off. As I think I did a lecture for some local dentists as part of like a in the open evening for the practice, and then got asked to do kind of like a VT lecture by one of the local VT advisors. Then started to do a hands-on day for them for anterior composites and do a lecture. From that, then kind of it kind of sprouted into a kind of day course for dentists, and so it's kind of focused all on anterior composites in my course. I'm in the process of developing a second day, which is more advanced anterior composite, techniques like diastema closure, um, black triangles, um, you know, any kind of tooth wear type of cases. So yeah, I mean, there wasn't any kind of nobody really kind of guided me into it. I just kind of fell into it and then kind of started to develop it. And to be honest, got a bit of a push from my wife because I think if she hadn't kind of you know told me to do it, I probably wouldn't have because she's like, you've got the skill and people want to learn, so you should really make up a course and you know spread that knowledge.
Everyone needs a cheerleader. Everyone needs a cheerleader, that's for sure. Awesome. So, Tariq, when you were speaking about starting your course, how did those early course days look? Was it was it was there ever like a big moment that you were you were scared, you were on the precipice of going into the unknown? How did that look for you? How did you manage that? How did you overcome that fear?
Yeah, I mean, initially, doing courses, obviously, for example, public speaking, it wasn't something that I was always comfortable with. And to be honest, in the kind of very first few courses, I found it quite nerve wracking, as I'm sure most people do. But like anything, the more you do, the more comfortable you get with it, the more, the content side wasn't an issue because, I've been doing this type of work for over a decade, and I know what I'm doing and how, why I'm doing it. It was just trying to kind of convey that, and to ensure that I'm a good teacher, so that people can actually learn and then use these skills in practice.
Well, it's a growth thing, isn't it? And you never grow in that respect until you find yourself in that situation.
Yeah,
You really, really don't. It's about putting yourself out there, and the person that you become when you can speak on stage and you can convey this message of whatever you like. It's an incredible thing. It's a gift. It really is. And I'll tell you something else as well. What I've noticed when you teach other people, you actually become much more knowledgeable yourself because
yeah,
people ask you questions, the most fundamental questions that you just sometimes have never thought of. And then you have to go right back and think, why do I do this? What does
yeah.
this mean? Why does this look like this? Etc. And yeah, it's part of the process, it's part of the fun, and that's one of the rewarding aspects of it too, is that you become better at your subject. That's what I've noticed anyway. What do you think?
Yeah, that's to be honest, I'd say that's 100% true because on a course, for example, somebody asked me a question, and I'm not sure about the answer. I would go and find out why I don't know, or what the answer is, or if I don't know, then I would ask somebody, and find out for them. But yeah, you're right. It makes you question why you do things, and why you don't do it a certain way, or why you use a certain technique. But yeah, definitely, and that's why I enjoyed doing the kind of visiting GDP clinics in the dental hospital a few years back. Because students would ask, well, why is this, and why would you not do it this way? And you think, why is it? Is it because I've always been taught this way, or is it actually any evidence behind what we're teaching and doing? So yeah, definitely. I mean, I think as you start to teach something, you kind of learn a lot yourself as well, and you pick up a lot from other people, that you're teaching, because everyone's got different experiences and different knowledge, and I think we all learn from each other.
I suppose a lot of people who want to start courses, probably one of the biggest barrier holding them back is, but am I ready? They say to themselves, am I ready to start my course? Do I have the knowledge? Do I have the skills? Am I at the level where I can be seen as a credible teacher?
Hmm.
What's your rules of thumb on that one? When are we ready to teach?
I think if there's a topic that you're really kind of passionate about, and you're sure that you're completely kind of immersed in that subject, then I think speak to colleagues, and you ask their opinion, what they think, and maybe kind of start small, by doing, say, like a lecture for your practice, or for a group of practices, or like a local study club, and take it from there. Because obviously it's a big step, just going from not doing anything to starting to do a course for, say, 15, 20 people, which is a massive step, not only in terms of kind of speaking, and teaching to that kind of group, but also to kind of actually run a course so that people kind of get the most out of it.
How do you feel about your decision to start your course? How has it panned out? How has it been for you as a person, as an individual? Was it a good decision, bad decision in retrospect? How do you feel?
No, I think, on the whole, it's been a good decision, and I'm glad I've done it. Maybe I wish I'd kind of done it, sooner, because I think if I hadn't been kind of, um, my wife hadn't encouraged me to do it, I probably maybe still probably wouldn't have done it. But I'm glad I've done it, because I do enjoy doing the courses, and I enjoy teaching colleagues, and seeing them kind of develop, and then get messages from, say, 2 or 3 months later, saying, thanks very much, I'm doing X, Y, and Z now, and picked up a lot of stuff that I'm using now in practice, and they'll send me pictures of their cases, and it's good to see that.
What I've noticed about these sorts of things is when you put yourself out there and you create a business or you put yourself out there in social media, you kind of have this. You envisage it to be a certain way, and you envisage it to be, you kind of don't really think about the full benefits of it. You only really think about, oh, it would be really cool to have loads of followers. um it would be exciting, it would be interesting, maybe it's a bit of an ego thing, maybe there would be money in it. But there's lots of ways that for me personally it's helped me as an individual, whether that be through relationships, networking, even just the positivity, like you've said, of someone reaching out and saying, "Oh, hey, I really like the podcasts." For
Yeah.
you, you've given us a little bit of a glimpse because you said, "Oh, it's really nice." Like 3 months later, people just message me out of the blue and they say, "Oh, this really helped me. I did this case the other day and it looked wonderful, etc." What were the greatest benefits to beginning your course that you never imagined would be the be even possible, or be things that would happen to you before you undertook it?
I mean, looking back now, even like for example, on the course or even afterwards, even small things that I thought were kind of small things that I kind of take for granted and do every day. It's new to some people, and they appreciate being taught a new skill. And it was just, even for example, the way you would kind of finish and polish a composite, or the way I would kind of layer it, or the way I would choose the shade. They're like, oh, I didn't know that, or I'd never come across that, but that's been really useful for me in my practice and made things a lot easier. Just small things that I thought everyone knows, and there wouldn't be any point in teaching. But it just kind of shows you everyone's got different kind of insight and different experience, and just kind of trying to kind of make sure people get the most out of that.
What's the workload like? Because I know that that would be something that might be considered or perceived to be a barrier for a lot of people who are on the fence or umming and ahhing about making a course. Is it? My guess is that the very first time you launch one, there is a heck of a lot of work creating the content, but after that, things are somewhat more streamlined because the bulk of the work has already been done. What was it like for you?
Yeah, so I mean, the initial kind of starting of the course is difficult because you need to get a lot of cases together. You need to get obviously a lot of content together, create a presentation, make sure everything's kind of flows correctly. So I mean, my say you've got kind of 400 or 500 slides. It takes a long time to kind of create that. I'm sure it took me maybe about 6 months or so to
Wow.
to get that kind of first course kind of all kind of up and ready. And people sometimes don't, I think, realize how much work goes into it, because you're just maybe doing this in the evenings and weekends, and then taking photographs of cases, or typodonts, doing stage by stage, and doing photos of each stage, getting the lighting right, getting the angle correct. So it's kind of painstaking kind of work, I think, trying to get it all correct. But you're right. After obviously you've got that kind of first time kind of set up, then from that onwards, it's much easier because you've got that kind of flow, and you're basically kind of just kind of repeating that process every time. But then you've got the kind of admin side of it as well. For example, getting CPD certificates, getting feedback forms, getting registrations, working with different kind of suppliers, different trade, different venues. So it's a lot of kind of stuff in the background that you need to kind of do to get everything correct as well.
I'll bet there is. Sometimes it is possible to create a course that there's two ways to do it really. You can get all your ducks in a row at the start before you've even launched the thing,
Mm-hmm.
or you can just create it week on week if you feel like you want to live a little bit more dangerously. There's pros and cons to each, because
Yeah.
if you create it week on week, you can modify what you're going to place in terms what you're going to put in there in terms of content based on what people have said the week before, and you can adapt it. And whilst you can do that with the first approach as well, what I mean is you haven't wasted any effort because you can tailor it even more.
Yeah.
And not a lot of people are aware that you can do it that way, but naturally it can mean that there's sometimes late nights and a lot of work to do if it's a little more last minute. but there's pros and cons to each. I don't know what balance you struck when you were creating yours. Did you have it all ready to go, or did you just change it week on, or did you just create it week on week? The only reason I ask is because a lot of people think that you have to have it all ready to go before you begin, but you actually don't, and there's actually sometimes merit in doing that rather than just being seen as somebody who leaves it to the last minute. There's actually some positive reasons why you may do that. I don't know how that looked for you. Were you very scrupulous? Did you ensure entirely that you had everything ready to go from the out as soon as the course was launched, or how did that look for you?
I mean, I think you need to kind of strike a balance, because you know, I think you can have most of the course ready, say like 90-95%.
Yeah,
And I think that's what mine was like, maybe kind of almost everything where I wanted it, but then you kind of slightly tailor it each week as well.
yeah,
But a few weeks, because for example, you might kind of, somebody might kind of give you feedback on maybe you should include this, or and then you think, oh, when you're presenting, you think maybe I should take that case out because it doesn't make sense there, or just change the order. So I'm always kind of open to doing things like that, just to kind of because you always, every time you do it, I think you kind of find ways to improve it. And I think you need to kind of continually do that and always assess things, because if you can't just be so rigid and think the course is perfect, because I think there's always kind of room for improvement, and it's good to kind of take on feedback.
you do. It's an iteration cycle. It's just like anything. It's like a product cycle, except for a course, and it's always going to be something that evolves and grows and becomes even better with time. It just has to be at that minimum level where the delegates are happy and they feel like they've got good value for their money. And then if you're able
Yeah,
to just consistently hit that level every time from the get go, making it better and creating even more value, there's a huge amount of satisfaction in that. There'll be lots of people listening to this who are wanting to start courses, maybe in the near future or in the distant future, but at some point it's an aspiration of theirs. What would you say to those people who are umming and ahhing and thinking about it, if it's right for them or it's something they want to do? What would you say to those people?
yeah. I think if you've got an idea for a course and you think obviously there's a different demand for it or a need for it, then and you know your subject matter inside out, then you should definitely look at teaching it to others, and sharing that knowledge, because we've all got knowledge that we can share and help others with. But I think the most important part is that you need to kind of know the subject matter well, because you need to kind of be comfortable with what you're teaching, and not just do it because you think you should do it. You should know. I mean, it's hard to maybe sometimes know yourself 100% whether you're ready, but speak to colleagues that you trust, friends that you trust, and get their opinion. Maybe, for example, test it out on them. Get a group of 6 or 7 colleagues in your practice, or your people that were friends from uni, etc., and say to them, "I'm going to teach this. What do you think?" And just go through your lecture with them, or go through your format and see what people think. Get feedback. I think almost like a little kind of focus group before you start it up.
There's a school of thought that says if you know a subject really well, then it's your duty or your obligation to share that knowledge with others rather than keep it all to yourself.
Yeah,
And that's a really helpful way of turning on its head whether or not someone should do a course, whether or not someone should create a course. I believe it's actually your obligation if you have a level of knowledge past a certain degree that would help a lot of people, that really rightfully it should be the case that you should feel obligated to go out there and share. So to me, that's a nice way of flipping things on its head and inverting our mindset on that one. So I hope that
yeah,
resonates with somebody. If anybody's listening, that might resonate with, that might be helpful. There'll be someone out there who's an expert in their field who perhaps doesn't have a program, and yeah, the fact is that probably what you have inside your head could help a lot of people. So that's a nice way of looking at it.
yeah. Exactly. I mean, I've heard a kind of saying before that knowledge increases by sharing it. And not saving it. For example, so if you've got some knowledge that you can share, that will increase your knowledge. And like what we were saying before, we learn from others as well. And every time you do a course, or you kind of do a kind of presentation, you'll learn from other people in the audience or on the course, people ask you questions, and I think it kind of works both ways. So I think, definitely, I think there's a kind of there is something we kind of should strive to.
I honestly believe that most people have something inside their head that could help others. Even if someone thinks that they haven't really got a body or a field of knowledge, if there's an experience that you've been through that you overcame, someone else somewhere will be going through that. It's just having the platform to be able to communicate with those people. But that's why social media can be so great, because it's given us this platform to reach out to these people that hasn't existed for all that long in human history. And that's why it's flipped on its head. This last year, what I've seen, what I've learned, and growing dentists who invest, it's flipped on its head how I looked at social media. I never really thought it was that positive a thing, but now I see it as, if you know where to look, there's a lot of positivity there. You know what I mean? It's not just fake news and conspiracy theories and stuff like that. There's a lot of people out there who want to connect, want
Yeah,
to know what you know, and you can help a lot of people. You just have to look in the right places.
yeah, no, definitely. I think kind of social media, a lot of the kind of, I mean, the dental groups obviously that are out there. There's pros and cons to being part of them, because sometimes it's just the kind of same stuff and people are just moaning. But I think there's a lot of kind of, you can help others, and for example, somebody might be going through a bad time or an experience, or say mental health issues and stuff, and we've all kind of been there, been associates, been worked in practice, had a complaint about a patient, and so I think we can all kind of help each other that way as well. And I think that definitely kind of has a big kind of bonus to it.
Positive, definitely. What are you, as regards to marketing your course and social media? Are you someone who uses social media a lot, or how is that? How do you spread the word?
To be honest, yeah, I mean, we've got like an Instagram page for the study club, and we do kind of share stuff on that. But a lot of the kind of courses, I feel are just kind of down to kind of word of mouth, and just people will visit the kind of the website, and see the courses on there. And so yeah, I think it's a lot of kind of word of mouth, because we've been running the courses for about 3 years now. So the kind of people come on a course, and then they'll look at other courses that we run and other speakers we get up to Glasgow. So yeah, I mean, I don't kind of market it in any other way. It's just on Instagram and Facebook.
Oh, okay, that's cool. So in 2021, there can't be too many courses and things who purely rely on word of mouth. But I suppose it's testament to the quality. Really, there must be a lot of happy customers.
Yeah, thankfully, I hope most people are happy that come to our courses, and I hope that it kind of stays that way. And we always kind of our main aim at the beginning when we set up the study club, was to kind of try and ensure that our courses are the highest standard in terms of menus, food, the speakers, the facilities, just to kind of ensure that everyone's kind of getting the best value, and the kind of best experience, from the courses. Been to courses before, and evening study clubs in the past, where you get kind of soggy sandwiches or just tea and coffee, and then you go home and you want to kind of have you have dinner again. But so on our kind of evening study clubs, we ensure people get a full buffet. They're happy with the kind of the quality of the speaker, quality of the food. So basically it's a networking experience as well. And from that's how we initially started, was just doing evening seminars and getting guest speakers to do an evening lecture. And then from that we started doing kind of full day courses, because that's what the feedback was. That's what they kind of demand. Um,
Tremendous, tremendous. And you started Scottish. You've obviously started dental Scottish Dental Study Club, as you mentioned at the start as well. What was the inspiration behind that?
to be honest, it was initially kind of a few younger colleagues had asked me to kind of go through some cases with them, and maybe have a get together, and do this maybe kind of every kind of few weeks. So the very first one we actually had, it was like kind of a small kind of group, maybe about 20 people, and we had a kind of a guest speaker who's actually one of my patients. He was a medical legal, QC. So he's a barrister, and he's specialised in medical negligence. and he does kind of lectures for the Royal College, etc. So he offered to kind of do a lecture on consent and ethics for me a while back. So I kind of took up on his offer for this. So we did kind of half of the evening was on case discussions, and the other half was on consent and ethics. So that went down really well. But then we did another one, and then I found that people weren't really bringing in cases, and people just wanted to kind of come in and listen to a guest speaker. So we started to just organise, a guest speaker every 2 or 3 months, and take it from there. To be honest.
That's awesome. And you might have said this, but how long ago was that?
So the very first one, this was in February 2018. This is when we started
Oh,
it.
I see. Okay.
So
And
we didn't do much last year, obviously because of COVID. So only kind of February and March we had things last year, but then after that nothing was kind of running.
Scottish Dental Study Club has a portal online and members and etc. and things like that, does it?
Yeah, I mean there's not a member it's not there's no membership
Right.
because we did think about this in the past, and know obviously this would kind of give like a kind of a more a better some kind of income obviously to do a kind of membership scheme. But to be honest, that and from my own experience, that's what used to put me off joining. A lot of kind of committees and organisations and things. So I didn't want it to be kind of for there to be any hurdle for anyone to kind of to come to our courses. So
Gotcha.
it's open to everyone. So it's scottishdentastudyclub.co.uk, and you can go on that and obviously kind of see what's on there.
That's awesome. So it's a bit dentinal tubules have went down the other avenue, haven't they? Because they have a membership, but I guess it's two ways to skin a cat. But you're what I've always my 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 concept or how I'd imagined Scottish Dental Study Club was it's the Scottish version of dentinal tubules. Is that about right? Have I got the right end of the stick?
Yeah, but yeah, probably yeah, but it's all kind of live events. So for example, we did do some webinars during lockdown for charity, and we had some kind of renowned, kind of world renowned names, like Pascal Magnier did a lecture
Oh
for us,
wow, yeah, wow.
Victor Sherbakov, Sarah Cookin, and a lot of UK based speakers as well. So this was for charity for Glasgow Women's Aid, which is a domestic violence charity. So we kind of raised about £5,000 for them last year, doing this just free over Zoom.
Nice. All for a good cause then. Awesome.
But apart from that, all of our events are kind of face to face on rather than online, because I don't think anything kind of beats kind of face to face interaction and kind of actual feedback on courses.
I think as well as that, what I was going to say was when you start something like, let's say your course or Scottish Dental Study Club, it's for me and Dentists Who Invest, it's like it's your baby. It's just different. You know what I mean? And it gives you so much energy, and it's just a massive reason to get out of bed in the morning, and it's a whole new lease on life.
Yeah.
I don't know if you feel that way. That's how I feel.
Yeah, I mean, and it makes obviously dentistry a bit more exciting. I do love my clinical work and enjoy that a lot. But it's different, I suppose, when you've got something else as well to kind of focus on. And like yourself, I like being one of these people that are always busy and doing things. And people always wonder like, how do you manage all this? But you get through it, and I've obviously got a lot of support with my wife. Obviously, we kind of share the workload with the study club. So it definitely helps. But yeah, it makes the job a lot more enjoyable, I suppose.
Definitely. And that is, I suppose for me, that's one of the greatest intangible benefits that I just enjoy doing it so much. And I hope that strikes a chord to somebody who's listening because even if you do something and it's a side gig and you don't do it for the money or it is a business and you venture down that path and it's not that financially viable, there's even a huge amount of satisfaction and happiness that comes from just creating something that helps other people
Mhm.
and that it's like another way to share what information you have inside your head, what is important to you, and the fact that other people pay attention to it or listen or are grateful, that is a massively massively cool thing, and I absolutely love that aspect to it. And Tariq, you'll probably feel that way as well.
Yeah, no, definitely. I mean, I think if I didn't enjoy doing it, I wouldn't be doing it, because I think to do well at anything, like I'm sure you know, you have to enjoy it, because otherwise it just shows that obviously you're just doing it for for the wrong reasons. And I think if you enjoy something, that's what you'll excel at. And I enjoy teaching what I do, and that's why I'll keep pushing myself to kind of make all the courses as best as they can be.
It doesn't feel like work to me. That's the thing.
Yeah,
There is no distinction between what I do in my spare time and doing this because I just enjoy it so much. And yeah, when something makes you that happy, it's worthwhile doing in itself, even if it's not, a business thing or to make money or a financial thing in any way. And yeah, that was why I started Side Gigs Month too, is to get people to think outside the box and to give them a new lease on life, as I said. So yeah, this is actually a bit of a milestone because this is the final podcast in Side Gigs Month, Tariq, and I wanted to have you on, like I say, just to put a hat on it because I want it to just have a diverse set of speakers who were speaking on lots of different things and have topics that I knew would strike a chord with lots of dentists. And I know for a fact there's lots of you out there who are interested in starting courses. And I thought, who better than Tariq, who's got a successful course and successful Scottish Dental Study Club. And by the way, can I just say something as well? Tariq has some of the best pair of hands I have ever seen in dentistry. Okay, and Tariq hasn't asked me to say that, saying that completely of my own accord. Check out his Instagram account, guys. It's wonderful.
thanks very much, James. That's very kind of you.
Oh mate, it's the work is really something. It's really impressive. So I think for as far as having a course goes, your delegates, they've certainly got a good teacher and someone who practices what he preaches, so to speak, on that one. So yeah, awesome.
Thanks very much.
Check it out, guys. Tariq Bashir on Instagram. It's really good. Awesome. Thank you for your time today, Tariq. And like I say, rounding off Side Gigs Month with a very with yourself, such an eminent speaker and somebody who can speak um, from experience on starting his own course because of what you've been through. I would love if anybody was inspired by Side Gigs Month. I would love it if they could reach out to me and just let me know and just drop me a message. And yeah, I love those sorts of stories. It would be incredible to hear some. No matter how that looks, no matter whether that's in dentistry, whether that's outside of dentistry, whether that's even taking up a new hobby. I love stories like that. So please feel free to drop me a message. Tariq, for anybody who's interested in your composite course or interested in learning more, is there a way they can get in touch with you?
Yeah, sure. I mean, I'm on Facebook and Instagram. So my Instagram's at Dr Tariq Bashir, or just go onto our study club website, which is Scottish Dental Study Club.co.uk. So you can drop us an email through that, or through my own Facebook, which is just Tariq Bashir.
Awesome.
Thanks
Thank
very
you
much,
for
James.
that.
I really appreciate you having me on. It was part of a great series, and honoured to be part of it. Thanks.
Oh, my pleasure, my friend. Thank you for giving up your time. And I hope we meet in the flesh someday because this is not the first time that we've spoken over Zoom and phone calls, etc. It's been quite a few times, hasn't it, really? So it'd be nice to meet you.
Yeah, definitely. Hopefully one day.
Someday, my friend, someday. Brilliant. Tariq, we're going to draw a line over under proceedings today. Is there anything that you'd like to say in conclusion to anybody thinking about starting their own course? Anything that you'd like to say just to wrap up?
Yeah, I mean, I think if you've got an idea, you've got the knowledge, and you want to kind of help others, you should definitely look at doing something in some format to teach some of your colleagues, either obviously online, on YouTube, or even an in-person course. And if they've got any questions, I'm more than happy for anyone to contact me. If they've got any, if they want, if I can help in any way.
Brilliant. Thank you so much. One thing I'll say on that actually, just before we finish things today, um, if you're unsure as to whether your program or what it is that what knowledge you have inside your head is actually going to resonate with a lot of people, or just how many people will find it interesting what you have to say, start a social media account along those lines, whether that be an Instagram or a Facebook group or something like that, and just see how it flies, see how much interest you get. And if you get enough interest past a certain point, then you'll know that you have you'll have enough people there who you can potentially, help them via the means of a program or the course. It's a nice, easy way, which is no cost apart from a little bit of time, to find out whether or not something that you'd like to share will sink or swim, or there'll be a significant enough amount of interest. So just a thought for everybody, just something that you might like to do if you're curious about whether or not you have a viable idea or notion in your head that you've come up with. So yeah, I hope that helps some people. Cool. Right, like I say, we're going to wrap things up today. Tariq, thank you so much for coming on the show. It's been my pleasure to be the host. I hope to speak to you again very, very soon. Hope you have a tremendous day.
Yeah, thanks very much. Thanks very much, James. Take care.